More, if you check the writings about Ibn Nawawi, you notice that most of the prescriptions are more of preventive. There are those that are treating diseases. Later on, we'll be looking at it again. Then another a concise definition, a very big definition that was defined by Dakar on his website. He defined Islamic prophetic medicine as a science that combines all that has come to us from the Messenger of Allah related to the subject of medicine, including verses of the Quran, the blessed prophetic traditions of the Hadith, the prescription of the Prophet as he administered treatment to some of his companions when they asked him for cures or when he instructed them in some remedy. His advices concerning healthy living of a human being pertaining to his food and drink, his dwelling and marriage, also covering the injunctions related to medicine and medication, the etiquette to be observed, and the legal responsibilities of the practitioner. This definition tends to include medical ethics, and there are publications concerning Islamic medical ethics, which is applicable not only those that are practicing the old system of Islamic medicine, but even the current practitioners, which is very important. Okay, then there is traditional medicine. Definition of traditional medicine become necessary because looking at the two concepts, the prophetic medicines and the Islamic medicine. The prophetic medicine, because of its theological basis, it seems to be like more of Muslims have no option but to accept that. So based on that, I consider like that one will just be like a Muslim nation accepting this practice of medicine. So based on that understanding, this particular form of medicine has fallen under traditional medicine. The definition of traditional medicine as WHO describe it as knowledge, skills, practices based on theories, beliefs, and experiences indigenous to different cultures that are used to maintain health as well as to prevent, diagnose, improve, or treat physical and mental illnesses. So if we look at the prophetic medicine in particular, it has to do with beliefs. We believe in the Prophet sallallahu alaihi wasallam. That's why most of the prescriptions he issued based on most of the statements regarding health, an individual may not be able to exactly experiment some of them in the lab, but we believe them and it works. Later on, we'll discuss it under various schools of thought concerning the practice of prophetic medicine. Then there is the new concept of traditional Arabic and Islamic medicine, which is TAIM, which is the common practice now. Most of the people we see in the society practicing Islamic medicine or prophetic medicine, what they are actually practicing in a real sense is traditional Arabic and Islamic medicine. It has been defined as a form of healing that has originated from the Arab area, that because it is originated from the Arab, so the religion of Islam also originated from the Arab. So in that case, the Islamic teachings has influenced the practice of medicine. That is where we got this traditional Arab and Islamic medicine. It marries those practices of Arab even before Islam, and then those that are not allowed in Islam were somehow expunged, just like magic and so on and so forth. So they have been removed, so that to produce a concept that marries the prophetic medicine and the Islamic medicine and the Arab medicine that come even before the Prophet sallallahu alaihi wasallam. The various components or the various items used include medicinal herb like the habbatus sauda, use of dietary supplements like the use of Zamzam water, use of spiritual prayer and spiritual healing in terms of Quranic recitation, and hijama, that is bloodletting or coughing. So what is the basic? There are three basic differences as stated by Hussein et al. 2019. He said he differentiated the prophetic medicine and Islamic medicine based on three criteria. The history: prophetic medicine started at the time of the Prophet sallallahu alaihi wasallam, while the Islamic medicine continued as Islam was expanding all over the world. Therefore, many cultures of the Arabian Peninsula, they tried to expand it to other world, and the emergence to other parts of the world, and the emergence of new diseases has prompted the Muslims to to start seeking for additional knowledge that they will tackle this disease. That's the beginning of the Islamic medicine. So it started mostly at the time of Islamic civilization, which happened between 8th to 15th century, which lasted between 8th to 15th century, which is usually considered as Islamic golden age. Then the definition and the sources of medicine. The definition, based on definition, we define what prophetic medicine was, and also it was, and people, sorry, somebody. Okay. And the way we come out about prophetic medicine is through hadith of the Prophet sallallahu alaihi wasallam, and which was the Sahaba of the Prophet were present doing it, and then what they saw, they learned from the Prophet, they pass it down to the subsequent generation up to date. While in Islamic medicine, it involves the combination of various forms of medicines. The prophetic medicine is also covered under Islamic medicine. The Ayurveda of India, which is far older than even the Arab medicine. It is believed that it has been practiced for over 3,000 years. The traditional Chinese medicine, the Unani medicine. The Unani is the traditional Arabic medicine. So that is the composition of Islamic medicine. Then the methodology, the prophetic medicine is characterized by, is basically under the principles of theology, Tawheed, that is Tawheed, and then the religious belief. While the Islamic medicine is usually based on the Islamic scientists, mostly those that were alive around that existed between the 8th and 15th century. They were the ones that moved this concept of Islamic medicine. Later on, we'll be talking briefly on some common publications that happened between the 8th and 15th century. Then, talking about health-seeking behavior, so many people believe there are group of thought in Islam. Some of them call them Sufi, those that have extreme belief of extreme ideas. Some of them believe that when you are sick, you don't need to seek for any help and so on. You stay there, because if you are looking for any form of remedy, then you are trying to fight the test, because sickness Islamically is considered as a form of test. Therefore, as Allah is testing somebody, he will now test you with sickness and so many other things based on the ayah of the Quran. But these people will now decide not to take medicine. So based on that, Ibn Qayyim in his book, Ibn Nabawi, and Imam al-Suwidi, they have all stated that the Prophet sallallahu alaihi wasallam, they quoted a hadith that the Prophet sallallahu alaihi wasallam, as narrated by Aisha radiallahu anha, that the Prophet himself has in so many instances sought for consulted physicians for a particular. That means that the Prophet himself has two things based on this hadith. The Prophet himself has sought for sickness, for physician services, and he has paid them for the services. Therefore, this one, the issue of seeking for health and then the remuneration of the healthcare practitioner is allowed in Islam, because the Prophet has done it. And also the Prophet sallallahu alaihi wasallam, another hadith, some group of Sahaba have suggested that he visited a sick person, and then the sick person, he asked them, has this individual seen a doctor? They said no. He said that they should call a doctor. They said there are 2 doctors around. He said that choose the most knowledgeable of them. Based on this, as Imam al-Suwidi has narrated in his book, Ibn Nabawi, it means that when somebody is choosing a healthcare professional, he suggested that he should go for the better one that is more knowledgeable, somebody that is knowledgeable on the issue of both the healthcare aspect and the religious aspect, so that when something, a particular item is not allowed in Islam, he will now advise him that this is against Islam, this is what Islam has permitted, and so on. That is, this second statement is based on the submission of Imam al-Suyuti. So the popular books written on Ibn Nabawi, there is the one that was written by Abu Nu'aym, who died 430 years after Hijrah. And then the second one, Ibn al-Qayyim al-Jawziyah, the student of Ibn Taymiyyah, he didn't actually wrote a book concerning Ibn Nabawi. What he wrote was Zad al-Ma'ad ila Hadi al-Ibad. Under that one, he created a chapter titled Ibn Nawawi. It was later on, people extracted that particular chapter and make it into the book and then name it Kitab Ibn Nawawi by Ibn al-Qayyim al-Jawziyah. Then there is this one, Imam al-Suyuti, the popular Imam al-Suyuti is a hadith scholar. He wrote books about hadith, like Alfiyat al-Suyuti. He has written tafsir and so on. So he also has his own, he's an Egyptian. He also has his own Ibn Nabawi. So these are somehow most popular. There are others like Imam al-Bukhari in his book of hadith. He created a chapter concerning healing. So some of the hadith was mentioned in that in those areas. Then this classification of illness is based on the classification by Imam Ibn Qayyim al-Jawziyah. He classified diseases into two. He said that there are diseases that affect the heart or the soul, and then there are physical diseases that affect the body. So based on that, the illness of the heart, he cited some verses of the Holy Quran, like the one in Surah Al-Baqarah, so he gave this one as an example of illness of the heart. Under illness of the heart, there are those of the heart and those of desire. And that of desire, he narrated, he stated of all wives of the prophet, you are not like any other woman. If you keep your duty to Allah, then be not soft in speech, lest he in whose heart is disease of hypocrisy or evil desire. This is the disease: hypocrisy, evil desire for adultery, and so on. This one's Islamically based on the classification of Ibn Qayyim. These are also form of disease. So the treatment of this form of disease, either disease of uncertainty and doubt, and disease of desire, they are based on the recommendations of the Prophet Sallallahu Alaihi Wasallam by following the teachings of Allah as demonstrated by the Prophet Sallallahu Alaihi Wasallam and as practiced by the Sahabas. May Allah have mercy on them. Then the second form of illness is the illness of the body. This form of illness is the normal illness we all come to know in one way or the other. Some of us might have taken of illness mostly in today's time. So he divided this form of physical illness or body illness into two. One that doesn't need physician's intervention, just our day-to-day need. Like when you are feeling cold, you put a sweater. When you are hungry, you eat food. When you are thirsty, you drink water, and so on. That one, based on his classification, is also a form of a disease. And then there are others that one cannot perfectly handle them except with the lead of an expert, like diseases like epilepsy, fever, and so many of them. So these are the classification. The first one is usually has to do with tawhid, while the second one is where there is intervention of the physician, more usually in there are some chronic disease, acute disease, and so on. In total, maybe, yeah. So the school of thoughts concerning prophetic medicine, there are the ulama, the scholars, Islamic scholars have somehow divided. Maybe let's talk about Ibn Qayyim. Ibn Qayyim is a religious scholar. He has written a lot of books. He's a student of the popular Ibn Taymiyyah. May Allah forgive all of them. So, and he has written books concerning hadith, concerning fiqh of Hanabila, and so on. So his own understanding of prophetic medicines, he said that it is sacred. It deploys religious values. It means that what it's the commandment under is the prophetic medicine. When the prophet says that Habata Sauda does this, does that, so it is due by all believers to follow it, because he gave an example. He cited this ayah. He does not speak anything of his own desire. It is only a revelation revealed. So based on this ayah and so many others, like hello, are we? I don't know whether we are together.
Yes, we are following.
Okay.
Yes, we are together.
Okay. And another ayah, so he said that all based on this school of thought, the ulama, the most popular among them is Ibn al-Qayyim al-Jawziyah, and this perception is being shared by most of the Sunni imams and even Shiites, because Shia their own form of Islamic medicine that includes the 12 imams, but I somehow stay away from that one. So based on that understanding, once the Prophet said that honey does this, then it is duty bound for even if you didn't practice it, it is wrong for somebody to, based on this course of thought, somebody said that this honey will not do that, because it will be like you are contradicting the messenger of Allah. That is based on this understanding. And in his and also in his submission in the book of in the chapter of the Nawawi in Zad al-Ma'ad, he said that this form of treatment prescribed by the Prophet sallallahu alaihi wasallam is different from the normal treatment by even the most experienced physicians, and also the form of medicines he gives is different and more superior than the one that are being used even at that time, and so many scholars up to date believe in that particular aspect, that if you use like zaytun, habata soda to prepare another form of remedy, habata soda has been described by the Prophet. So when you use it to prepare another remedy, it will not be as the same as when you use any other compound, because that of habata soda was stated by the Prophet. Their argument here is that it is the Prophet, and since the Prophet don't say anything except it is revealed by him from Allah, therefore is superior. Then in the book, Ibn Qayyim has stated about 61 medicinal plants, that plants, herbs, and shrubs, and also the hadiths that talk about treatment and remedies and prevention, about 1,000 statements from the Prophet sallallahu alaihi wasallam, directly from him. Then the second school of thought, they believe that this is bound on time. It is just the Prophet sallallahu alaihi wasallam, whatever he does, whatever he stated or act based on the religions like as-salah, az-zakah, hajj, and so on, is duty bound by all Muslims. But their own understanding, the most prominent proponent of this school of thought is Ibn Khaldun, the philosopher, sociologist, economist, and so on. In his book, the introduction, Al-Muqaddimah, introduction to history, Al-Muqaddimah, he stated that what the Prophet sallallahu alaihi wasallam in a hadith, he said that you are more knowledgeable of your worldly affairs matters. It means that because this hadith specifically was regarding plant husbandry, that some people, the Arabs, have a way of producing dead trees. So when they asked the Prophet sallallahu alaihi wasallam, the Prophet told him that you are more knowledgeable about these issues concerning world. So based on this understanding, the people in this school of thought, like Ibn Khaldun and Ad-Dahlawi, this is an Indian scholar. He also wrote tafsir and some books. Their own understanding is that when the Prophet says something concerning the religion, concerning ibadat, is form of revelation, therefore is duty bound to all. But the human attitude and information about worldly things, and they believe that it's related to the Arabic practices. Like they said that Habbat Sauda is a popular seed in the Arabian Peninsula even before the coming of Islam. So the Prophet just repeated what is there. And also they say that it is contextual, like in the recommendation on the treatment of fever by the Prophet, where he said that when somebody has fever, he should bath with cold water and so on. They also cited that hadith that the Prophet sallallahu alaihi wasallam stated that hadith at Hijaz is a place in the Arabian Peninsula that have their temperature, the average temperature is very high. So whenever their fever usually is assumed to be due to heat stroke. So they believe that that one applied to people of Hijaz, not the whole world. So, and also they propose an argument that for a physician to be able to say that, for somebody to learn that this particular drug or this particular medicine cure this, you need to must have seen the particular symptoms. Like if you say this is having a pimple, what is the nature of the pimple, what is the cause, and so on, then the appropriate treatment. They say the Prophet ﷺ prescribed based on what he saw, and therefore, if it is what he saw, there were no hadith that described the symptoms of those illnesses the Prophet report. So this is their own understanding. So their own is that even though they tried the prescription of the Prophet were effective, if somebody try it now and it's not effective on him, he shouldn't pacify the hadith of the Prophet. It means that he's using it for the wrong disease. The wrong disease in the sense that if it is, let's say, stomach problem, stomach issues, like in Hausa, when you say chiki, it involves the intestine, the stomach, the storage area, the large, small intestine, the anus, and so on. They are all part of the stomach. So when you say somebody has stomach problem, it could be the intestine is blocked, the liver has issue, and so on and so forth. So what they are saying here is that the Prophet, when he said use honey, he knows specifically why he is stating why he directed them to use honey. Like, yeah, Allah has told him that this person should use honey because the problem is this, and Allah will take care of that. Allah, they said, we presently don't have this on this revelation. That's their own understanding, which so many scholars didn't buy into this idea. This is a common discussion, and in the process of compiling this presentation, I noticed that most of our colleagues, like the practice of the medicine of the Prophet, it was during his time, is time bound. They are not, they will never say it, but practically they are part of it, in the sense that some of them, like, honey for stomach problem, why? It doesn't use it, and we accepted that, but it will not work now. That is in practice. But it is, when they are talking, they will talk that whatever the Prophet says is duty bound, is perfect, and so on and so forth. That is what Ibn Khaldun and Ad-Dahlawi school of thought says. The popular books on Islamic medicine, our popular physician Ibn Sina, Al-Razi, and so on, they belongs to, they come later after Ibn al-Qayyim. So their own is more of the scientific, the beginning of scientific Islamic medicine. Most all of them are physicians. Unlike when you look at Ibn al-Qayyim, which is a scholar of hadith, fiqh, and tafsir. But these are physicians. So the books they wrote is usually based on case report, their experiences in the field, and the way they handle their patients. So the Canon of the Al-Qanon Fiqh by Ibn Sina in the 11th century, Al-Razi wrote the one earlier 10th century concerning diet therapy use of by treatment of disease from the angle of nutrition. And also Kitab al-Mukhtar al-Fiqh, Selection of Medicine by Hubal al-Baghdadi, Kitab al-Shama'il Sana al-Tawbiyah, comprehensive book in the art of medicine. This is also written by Ibn al-Nafs. These are physicians, and what they wrote is based on their experience in the field. I was talking to somebody, said that there was epidemic of obesity then. So all of these 4 books, they dedicated a section in their book where they relate obesity to so many chronic diseases. Like even now, there is a place where he said that when somebody is obese, it tends to limit the rate at which he inhales air, and that one its affect its circulation, can lead to cerebrovascular accident, and so on and so forth. So these are based on the things they see and so on. So all of them wrote something about that. They are scientists, this group of people, they do it based on what they see from what time to time. Even Sina was so popular to the extent that his work has been used up. This Al-Qanon Kitab was translated, I think, even into to Latin, and it is being used up to the 17th centuries, middle of 17th centuries in Europe. It was later with time, so many of the writings were changed or upgraded based on the scientific finding. There are other scientists that are writing valuable works, but this one seems to be much more popular. Then going back to the issue of prophetic medicine, as we made mention, there are at least 61 plants or herbs that have been prescribed by the Prophet Sallallahu Alaihi Wasallam, and there are at least 1,000 narrations, which is very common. There is English version of the Ibn Nawawi by Imam al-Suwidi and Ibn Nawawi by Ibn al-Qayyim, and even I haven't laid my hand on the Abu Nu'aym one, but it should be available, so one can go over it. So as a pharmacist, as a healthcare professional, there are, to say a particular item is curing this is different, maybe much more, maybe one aspect of it. And the second aspect would be how to use it and how to monitor the outcome. So I decided to take one item, Habatus Sauda, which is very popular around our place here. It's plant Nigella sativa, Habatus Sauda, black seed, and I think there is another name, is it black cumin, and so on. So one of the reasons why I picked this particular Habatus Sauda is the hadith of the Prophet. It stated, it was narrated by Abu Hurairah. It is present, it is there in Musnad Imam Ahmad, Imam Muslim, and Ibn Majah, and then Imam al-Bukhari, and the hadith is authentic. The Prophet said, use this black seed regularly because it is a remedy for every disease except that it has the potential to be used in treatment of every disease except that. Then this particular hadith has stimulated scientists and researchers to write a lot of books, to conduct a lot of researches concerning this particular Habatus Sauda or Habatul Baraka. Hussein and colleague has conducted a review concerning so far what has been documented concerning Habatus Sauda. He stated that researchers have shown over 100, the plant has over 100 compounds inside the seed, and 69 of them have been characterized and identified. Still, there are more to go. Then also the active ingredients, apart from others that have been identified, include thymoquinone, dithymoquinone, thymohydroquinone, nigellone, thymol, and fixed oil. And also he also stated that there are over 600 publications. Out of these 600 publications include books, chapters in a book, and research publications that have been done on black seed alone. So I tried to limit my searches into to the recent findings, like Saka, Elswade and Saka have investigated the anti-diabetic property of this particular plant on laboratory animals, and they found it to be promising in that aspect. And also the antihypertensive aspect of this black seed was also reported in a review by Mushraf and Saiful Islam. Also, Hussein also suggested that this active ingredient, thymoquinone, can have beneficial effect in breast cancer. And also, Naina, in a review, she conducted a systematic review whereby she looked at published studies, and she suggested that this particular Habatus Sauda can also be used in the treatment of COVID-19 among so many researches available. And my own take is this. When I was having a discussion with my mom prior to this presentation, I told her that I'm going to do a presentation about this. She's a particular proponent of Islamic medicine. She's so much, at every moment in time, she will have at least 3 or 4 types. One of the things she was telling me was that she will just bring something that if I search on the web or I search for any publication, I may not even see it. Somebody will just mix some powders that you cannot even identify them, and they will tell her this is for that, this is for this and that. And then because of that belief and so on, she'll use it, and at times the result will be there, or the result may not be conspicuously present. The issue with the application of probiotic medicine in our present situation is that most of the people, most of the healthcare professionals or the healthcare scholars that are in the health sector, they hardly conduct applied researches, not only the lab one where you identify the compound, whether they have potential also. They rarely you come across clinical trials that are testing the efficacy and safety of these particular drugs. Maybe in applying to other diseases like this one that's suggested in COVID-19 and so on and so forth. So that one has created an issue. And also we have another issue in Nigeria in the sense that we have practitioners that somehow see science as negative religion, instead of them to see that science and religion are going hand in hand. And so they keep on practicing. They created a practicing environment whereby anything science will now be viewed as an enemy, perceived as an enemy, while anything that's common logic will not even accept it. They will now see it as the truth one. Later on, we'll talk about the reason why people patronize people that practice form of medicine. Some other researches like concerning hijama, coping. There is even so many studies have done that. Concerning hijama, there is a randomized controlled trial concerning hijama, and they show that it has been shown to be effective in treatment of specifically a relieving pain. It is similar to acupuncture that is native of TCM, traditional Chinese medicine. Zamzam, somewhere in 2018, 2019, BBC, the TV station, have somehow suggested that Zamzam has the possibility of causing cancer and so on and so forth. That stimulated Muhammad and colleagues to conduct research on Zamzam. And they do it, they try it in the lab on laboratory animals over the period of between 3 to 6 months. They noticed that Zamzam has the ability it has uricosuric effect. It promotes the excretion of uric acid. It has hypolipidemic effect. It's low density lipids, and also has other effect on triglyceride and so on. So they now concluded that the statement made by BBC is not supporting the findings from the lab. The BBC just made the statement, but they decided to go to the lab and test what is in Zamzam. And also another research, so many researches about listening to the Quranic recitation. There was a particular one that I couldn't lay my hands on now. Somewhere last year or last 2 years, I read that it could help people with depression and so on. But in treatments of anxiety, Ashraf and others also conducted an experiment. They noticed that it will be added in the treatment as a non-pharmacological measure in treatment of anxiety. Thoka and Patel conducted a scopy review, and they compiled 20 plants that have been mentioned in the Holy Quran, and all of these 20 plants were investigated to have antipyretic properties. So who are those people the characteristics of people that patronize this, the people that practice that practice traditional Arabic and Islamic medicine. So the factors that made people to go and patronize it, the people, this research was particularly specifically conducted in, I think it's Pakistan. So the people stated that one of the reasons why they consult traditional and Arabic Islamic medical practitioners is because most of them are not satisfied with conventional methods. Our conventional method of using orthodox medicine or so-called Western medicine, they are not that satisfied, and also the spiritual related problems. So people with genes and other things that at times considered spiritual, they are the ones that are more likely to patronize them. And this dissatisfaction, there was a study I read, they said that the dissatisfaction is that people with chronic diseases like schizophrenia, epilepsy, and so on, they are chronic diseases that require taking drugs for a longer period of time. So it's not, and with the effect it has on of the brain, and some of the at times mood, like the bipolar, it's not an easy task to determine the endpoint of these particular items. So patients are more likely to report unsatisfactory effect of this drug, and also the side effect of this drug. But still, this group of patients with chronic disease stated these reasons as the reason why they patronize Islamic medical practitioners. In a research, Aziza has reported that 70% of people in developing countries, including ours, are believed to be patronizing, believed to be using one form of complementary and alternative medicine or the other, which traditional Arabic and Islamic medicine and other traditional medicine aspects fall under. So based on that, many people in Malaysia, people that were included in this research in Malaysia, most of those that patronize them are either having issues with infertility, epilepsy, psychosomatic troubles, and depression. This particular study has not stated what are the outcomes of this, what are the people that patronize this, people with that practice traditional Arabic and Islamic medicine. They have not stated the outcomes of the treatment. And in Saudi Arabia, most of the people that visit Islamic healers or people that practice TAIM are usually people with psychiatric illness. They conducted a survey and they gave a self-completed questionnaire to people that are patronizing these practitioners. They now notice that most of them have psychiatric illness, and majority of them have not visited healthcare settings, and they are relatively younger people. They are mostly ladies as well. So another thing is, in that questionnaire, they now notice that most of them could have the diagnosis of depression and anxiety. Had it been reported to healthcare facility. And also in another research, it has been shown that most people that are also patronizing this kind of care, they hardly report that their treatment on alternative medicine to their conventional healthcare professionals. Then the issue of safety, the level of knowledge of this practitioner regarding safety of this medication is uncertain. I've tried to find out mostly in our locality here in Nigeria. I couldn't come across research that assess the level of knowledge concerning the safety of these particular medications, because in traditional Arabic and Islamic medicine, it's not only Hippocratic medicine, it involves other medicine that have been practiced in the Arab region, the Unani aspect, even before the coming of Islam. It involves traditional Chinese medicines, it involves Ayurveda. So because of this combination and the issue of adulteration, one cannot say that these items are devoid of serious side effect or long-term side effect. So the level of understanding of healthcare of this Islamic medical practitioners on this regard is not easily accessible. And also, Ozawa has reported that this level of falsified and substandard medicine in low and middle income countries, this is based on conventional medicine, not even complementary and alternative medicine or our traditional medicine, 13.5%. If we are talking about medicine that in most cases pass through regulatory checks, unlike not something that some of our producers of traditional medicine do it in their backyard, and nobody can easily tell you that this is the level of adulteration on this particular items, on this particular healthcare product. A common term that is used by so many Islamic traditional Arabic and Islamic medical practitioners is this medicine is devoid of side effects. Whenever I come across of anybody that is saying that this is without side effect, I do give them a very funny example that a person that has a wife and he intends, is Islamically allowed for somebody to take a second wife. I hope my wife is not here. Is Islamically allowed to take a second wife. So, but when he is, most ladies, when he is seeking for the second wife, the lady inside the house may develop a kind of antagonism that she will not like the other woman. She'll be calling her and so on and so forth. Is something allowed? And the individual desire to add the second one, but the other one is seeing it as something not desired based on the wife inside, but wife at home. But the husband tends to will just like to have a second wife as it is allowed in Islam. So I try to link it up with side effect. And for those that can easily understand, I try to give them the definition of side effect, or the simple definition of side effect, that when we say side effect, it doesn't mean it may be just harmful. It may not be harmful. It is just something that you are not intending. Your intention is not to cause this thing. Maybe you are giving somebody a drug for headache, and that particular medicine made that individual to sleep. That's not intentional. That sleep has now become a side effect. That's what I normally tell them. It can become problematic or nauseous or harmful. That is when it becomes an adverse effect. But still, most of those that I have discussion with, they believe that their drugs doesn't have side effect. It's a popular thing among the practitioners and among so many Islamic scholars. Okay, then since most of the medicines that are being used in traditional Arab and Islamic medicine are herbal, I now look at this particular report that said that the common toxicity associated with herbal remedies are usually hepatotoxicity, and the less common is kidney, nervous system disorders, blood issues like anemia, cardiovascular and dermatological effect. Dermatological effect like reactions and so on, mutagenicity, initiation of mutation, and ability to induce cancer, carcinogenicity. Then another research, a recent one in 2018 by Fad and Al-Karari, they reported that the prevalence of adulteration of sexual sex enhancers with adulteration with conventional medicine like sildenafil, tadalafil, and so on in these herbal remedies is 23%. So if this is 23%, that is this prevalence, it means that out of every 100, the list around 23 of them have been adulterated. I tried to get access to a research by a colleague that did it in 2018 in Zaria here. He sampled these enhancers from Kano. He now tests them for the presence of this adulteration, and my discussion with him then was that he noticed over 40% are adulterated with this particular product, but I couldn't find it online. That's why I have not cited it in here. Then other drugs and sexual enhancers, the reason why I'm mentioning them here is among the common thing. If you could check to these places where these items are being sold, it's either they are selling sexual enhancers for men or for women. It's a common product that is being sold there, to the extent that I visited a shop where that individual is selling is selling sildenafil and tadalafil under the guise of selling traditional Arab and Islamic medicine or prophetic medicine. So that's why I'm citing these particular items. In this one, these particular researchers, they noticed that among the most common adulterants, apart from the tadalafil, some of them do include tramadol in the sexual enhancers. And also in their pain medicine, the most common adulterant is tramadol. So presence of these particular substances increases the risks or the chances of experiencing not only the side effect will not be adverse, will not be harmful. Because even if the primary product is not toxic or is relatively safe, the addition of this particular orthodox medicines or chemicals will not make it a possibility to form another compound or to create another issues, which we all know sildenafil, they have tendency of causing headache, partial flushing, and so on and so. This is very common. So in the presence of this, even if the plant is safe or relatively safe, but the presence of sildenafil will now promote that. And these particular drugs in sexual enhancer that are being sold in this Islamic chemists and courts, they may have similar mechanism of action as this orthodox medicine, causing vascular, increasing blood supply, and so on and so they may have. So if they have that one, the side effect may be cumulative, or they may have they may produce a, if I can use this one, synergistic or additive adverse effect because of the presence of two drugs with similar mechanism of action resulting in similar toxicity. So the issues in Nigeria, there was this interesting research by Toko concerning HIV, the use of traditional medicine by people with living with HIV and AIDS. He did it in Kano, very interesting research. It was a qualitative research. He has discussion. He spent almost 16 to 17 months conducting a qualitative research. Most people, their belief is that because of the habit of the prophet, to every disease there is cure, or no disease that Allah will send without the cure, and so on and so forth. So at the advent of HIV, many people that were diagnosed to have HIV, they will now either their malams or somebody will now advise them, or based on the discussion they will hear in town, or based on their perception of or based on their understanding of the particular disease, they will now stop and their antiretroviral drugs. Or another very common one for our colleagues that are practicing in the community or hospital, they will notice that most of their patients, you may have a patient that you have been following up for quite some time, and then you stop taking the drugs. When you consult with the patient, he may end up telling you that my particular practitioner has told me not to join it with orthodox medicine because orthodox medicine will create problems. So that instead of, and most of them will give you the justification, it may not even survive the scientific scrutiny. So the patient that were using this, they noticed that most of the patients that stop attending care in the healthcare facility, they resorted to that one, to taking the concoctions and so many combinations on unauthenticated products, in the sense of going to have a cure. They end up coming back to hospital with worse clinical outcomes. Most of them they develop resistance to the drugs, to the extent that most of them would have to go to second or third line of therapy. There was an interesting narrative he gave in the paper. There was a HIV positive client that was hired by the NGO that she should try and be convincing people to be taking their medication. She was part of those rendering enhanced adherence. So the lady will come and do her job, collect the advise others to take their drugs regularly, and so on and so forth. But unknown to them, the lady was not taking her drugs. Suddenly, she started experiencing OIs, opportunistic infections. When they checked, they noticed that her viral load was so high and her CD4 count has gone extremely low. When they investigated that, that woman has not been taking her drug. All she do is she see the clinic as a source of income. She come and do her work and then continue until she went back home to take her concoctions and so on and so forth. This is how the things are. I tried to get other researchers that focus specifically on traditional prophetic medicine, traditional Arab and Islamic medicine, or most of the studies I saw that of other traditional medicine. So I found it less relevant to our presentation here. So these are some questions that I tried to answer in the presentation, but I couldn't. To what extent people utilize this practice of traditional Arab and Islamic medicine? In Nigeria, this data was not readily available. What is their perception of the effectiveness of this particular form of therapy or treatment? Perception of the patient is not readily accessible, since we all know that the educational background of healthcare practitioner will influence the practice and the effectiveness of the practice. But what is conspicuously lacking in Nigeria is that the assess a single research that assess what is the educational background of people that are practicing. Are they just did they have any healthcare training? Do they have or are they Islamic scholars, or what are they? What informed their choice of a particular remedy over particular remedy in a particular medication, in a particular treatment? Then what does practitioner know about their safety and drug, about patient safety and drug interaction? I talked about the level of knowledge of safety. So do they have any, even however small the knowledge is, concerning drug interactions that may influence patient safety? I couldn't find a research of this. Another important thing is that the physicians who said that when you diagnose a disease, you have reached like about 90 or above 90% of handling the disease. So these particular practitioners, how do they arrive at most of their diagnosis? I recently had an encounter with a female neighbor. She she told me that she had series of tests, even X-ray scan, that they revealed that she didn't even have she wasn't pregnant. She did another test. Is that they told her that she was pregnant. Later on, she has discharge, blood coming out, and she went to the hospital. They did X-ray scan, and they told her that she had an abortion. But when she resorted to seek help from one of these faith-based healers, he told her that she has jinns or evil spirits that have possessed her, and she has been pregnant for 6 months based on his own diagnosis. So he could give her medicine that could awaken the pregnancy, and then God willing, inshallah, she is going to deliver in the next 3 months. So I now asked the lady, so what does she told me that he sought for financial, he demanded money from her. I told her I would personally sponsor it, so that I would want to find out the outcome. My question was, how does he arrive at the diagnosis? How does he arrive at the age of the pregnancy? He even told her she has been pregnant at 6 months. And then the issue of identifying gene, that one is for another day. Then also the research for possible drug therapy problem is, since these practitioners assume the role of physicians, most of these practitioners, they are the physicians, they are the pharmacists, they are the nurses, and if it comes to administration. So there could be drug therapy problem. So there was no single research I was able to lay my hands on. Drug therapy problem either the form of interactions, inappropriate medication, additional medication needed in handling this, and to what extent this practitioner employ evidence-based practice. I've spent over 2-3 weeks trying protocol concerning the use of evidence-based practice regarding specifically targeting traditional Arabic and Islamic medical practitioners. In Africa, I couldn't get any. I noticed that there was one that was done regarding to chiropractors, physiotherapists, and so on and so forth. Those that are using CAMs, but none related to traditional Arabic and Islamic medical practitioners. I think my own assumption, if the scholars could be able to answer this question in form of research, could definitely contribute to the practice of this individual. Thank you for listening. These are some of the references. Thank you.
Thank you very much, Pharm Abbas, for the very rich, captivating, intriguing, and interesting presentation. Now we'll open the floors for questions, comments, and observations. And I can see we already have some questions on the chat box. But my question too, before others, please. I don't know, please, are you with us, Pharm Abbas?
Yes, I'm with you.
Okay, thank you. Yes, please, how do I get access to those books you mentioned? Books by Ibn Sina?
No, those ones I actually couldn't get access to them. The Ibn Sina, when I checked online, they were, but the Ibn Nabawi by Imam Suwiti and Ibn Qayyim, I'll share it in the group.
Okay. Thank you very much.
And also, I have encyclopedia of Islamic medicine. I'll share it, inshallah.
Oh, we really appreciate it. Thank you. I think Dr. Ibrahim Jacho has a question.
Assalamu alaikum. Yes. Assalamu alaikum. Thank you so much. Can you hear me?
Yes, I am with you.
Okay. Thank you so much, Pharm Abbas, for this very amazing presentation. I'm seriously amazed and well informed about the presentation. It is well researched and we really appreciate it. And I wish other presenters could adopt your style to make it well, to make it a well background research, to present it with evidence. And I would also like to appreciate your efforts by trying to bring some knowledge gap so that some scholars who are willing to proceed or to fill the gap can, which is a very good research. My few question is, I think my expectation again was, I was expecting to hear some section about our common Islamic medicine that is very common in the North. All this, every line, every street you go, you see Islamic chemist, Islamic this, that, and that. So I was expecting, or maybe what's your comment on this predominant in the North? And that's number one. And number two, I shared a link where I think in Kasina, this Islamic medicine are making a hell of money especially from women, about what an aspect that you just mentioned about issue of all these sexual aphrodisiac or getting things when they're preparing themselves when they're about to get married or when their husband is about to marry an additional wife to make them, to equip themselves. So I was expecting maybe what's your take on Islamic medicine chemists in the North? And then my last question is about the safety issue. Yeah, I did my research, my master's research in a trauma center in Malaysia, where we assessed drug-related emergency visit. And part of what we saw is some safety issue related to black seed, that is hepatitis soda, where a lady came with a miscarriage, and after assessment and the medical team conclude that it's from the black seed that she took. Maybe she took an overdose and that resulted in the loss of her pregnancy. So I think in addition to the adulteration with orthodox medication, some still do have these side effects. So thank you so much for your presentation, and I have really learned a lot, because today I even learned the difference between prophetic medicine and Islamic medicine. And thank you so much.
Thank you, sir. Concerning the presence of Islamic chemists, it's similar to us here in Zaria. A lot of them, and they are making big money. These people are hardly regulated, and they hardly even face tax because they are not incorporated. So their predominance, like the research I cited concerning those that patronize it shows that people that tend to have female gender has been identified as a factor. Females are more likely to patronize them, and also the level of education, younger age, and so on. So if we look at the female gender and the age, female gender and the level of education, I think it could explain why our own here is also so rampant. We have a lot of ladies, and this is a place where we are mostly Muslim. We are all majorly Muslims and so on. So female may need so many things because of the nature of the environment, and also the level of education play a significant aspect. That based on my area here, we have like five of them. And I'm telling you, if you go there, there are people that are exposed that go there, but most of them have low level of education. Most of them hardly go beyond secondary school. So that one might have called the level of knowledge might have contributed. Thank you.
All right, thank you so much. Yeah, actually, there are some questions people posted. Someone was asking, can you recommend a medicine for sleepless night for an old patient? That's what he's trying to say.
So there are does he mean I don't really get the question, like I should recommend a medicine for sleep?
No, yes, like if an old lady doesn't sleep well, and can you recommend like an Islamic medicine that can make her to sleep?
Okay, thank you. I think I like this question. This is what we are actually trying to point out. You see, lack of sleep can result from so many things. And looking at the age, the best thing is the individual should see a physician, let him check her properly, and then after checking, she can opt for Islamic medicine after proper diagnosis. But the sleep may be the insomnia may be as a result of something else. Just taking the drug may just mask a particular symptom, but seeing a healthcare professional to diagnose it properly may go a long way. Thank you.
Okay, let me add to this before Ajia read the remaining questions. I use this Islamic medicine very well. Even now, I still have some in my room. And for this sleeping, anytime if I want to sleep, the only thing I need to do is just have a warm water and put, I don't know if it's Islamic, but I just do it. And this nutmeg and cinnamon powder. So I mix it with honey and milk. And if I take it in a matter of a few minutes, I'll have a very sound sleep. So I'm not sure if it is, Islamic or.
There is a preparation with cinnamon that is used for sleep. But still, considering the age, I think the something she may need to, so that if there is any underlying problem.
Yes, it's true. So Ajay, you can go through the questions and read them out.
Okay, Prof. Yeah, the next question here is there any collaboration between the scientific world and the Islamic and prophetic medicine practitioners to address some confusions and questions?
So yeah, I could say yes, and this question is a little bit tricky. As I said when I was talking about Islamic thought, you see, when you want to verify the clinical effectiveness of a particular medicine or a particular drug, You can't just do it alone. You have to be involved in healthcare aspects. So most of our healthcare researchers is either a particular product may show promising effect in the lab and so on and so forth, but translating it into practice may be a little bit challenging in terms of financing, challenging of willingness of the researchers, and so on and so forth. So not all of our Islamic colleagues that think that these things can be promising in future. But to me, there is collaboration, because all the researchers we mentioned, there are scientists that did that and so on and so forth. But the practitioners, they have issue. Most of them are not so welcoming to scientific ideas.
Sure. Thank you. Then there's another question that says, was polygamy factored in on the use of aphrodisiacs in women?
Actually, I don't know. The researchers I read, none of them actually talked about that. Maybe the researchers, because they are not Nigerian, so polygamy seems to be highly prevalent in Nigeria, so it does not factor. Even the one that was conducted in Pakistan have not considered polygamy as a factor, as an independent variable.
Okay. Then this is a comment that in Nigeria, I know I've come across an institute in Abuja that incorporates the Islamic medicine to, as you said, the treatment approaches using hijama. Now,
yes,
it will be good. She said it will be good to see more effort on herbal approaches.
Sure. It's very nice, and it will provide another platform that will be more cost, that will save cost.
Yes. And there's another comment that says, great presentation. It was an eye-opening. I feel pharmacists need to incorporate Islamic and Orthodox medicine. It will help in patient follow-up and detection of drug therapy problems.
I also buy this idea, and apart from that one, actually there is apart from helping the patient, the pharmacist, it has a very viable financial contribution to the practice. There is a lot of money in this Islamic medicine, so I think it's a very nice lesson.
Some people are raising hands.
Yes, Salman, Muhammad Umar, I don't know if you are ready. You raised your hand. If you want to ask your question, you can ask now. Okay. And Ibrahim Yunus,
Assalamu alaikum.
Alaikum salam.
Please, am I allowed to speak in Hausa?
Yes, you can.
To assalamu alaikum warahmatullah. Bala Abbas, Allah saka da alkai da wannan presentation da kai, Allah ubangi saka da alkai. Wato, you comment ina shine wato akwai bangaren da ba a taba ba. Na farko tukuna shi Allah wato ya halicci dan Adam. Wato akwai physiology da anatomy da biochemistry da ba a taba ba. Kuma kamar ganda muka sani a tarbiyyar mu na ɗaliban pharmacy ko medicine, wato alakanta physiology da anatomy da biochemistry tukunna. To idan muna son mu fahimci Islamic medicine da prophetic medicine, dole sai mun fahimci tukunna ya Allah ya halicci dan Adam. Na farko wato Allah ya halicci dan Adam da zuciya wato da kuma jiki. So mun karanta wato a hadisi cewa a jikin dan Adam akwai wani wato tsoka, in yayi kyau dukan jiki yayi kyau, idan kuma ya lalace dukan jiki ya lalace, sai ya ce zuciya ne. To idan ka duba zuciya, me suke raya zuciya, wato me yake lalata zuciya, sai Allah ya bayani cewa wato inna sam'a wal basar wal fu'ad kullu ulaika kana anhu mas'ula. Akwai abubuwan da kake ji wato idan na kwarai ne wato suke gyara maka zuciya, abubuwan da kake gani in na kwarai ne da su gyara maka zuciya, idan abubuwan banza ne da su lalata maka zuciya. To kaga shi bangaren zuciya kenan. So akwai bayanai da yawa akan wannan maganar zuciya, in yayi kyau dukan jiki yayi kyau. To shi kuma idan muka dawo wato gangan jiki, me Allah ya halicci gangan jiki da shi. Wato abin da ake mun sani mun karanta cewa the simple and basic unit of life shine cell. Oh,
yeah, well,
cell.
please, some people are complaining that the Hausa is kind of confusing them. They are lost at the comment section.
No problem. No problem. Let me revert back to English. That
Okay, thank you.
Allah subhanahu wa ta'ala created, us all from the heart and then the body. You understand? And there's hadith of Rasulullah says that in the body there is a flesh. If that flesh become good, then all part of the body become good. So he mentioned that part of the body is heart. And then we look at it, what bring goodness to the heart? That one will take care of what you hear. Asam, what you hear. Al-bastar, what you see are the things that make your heart stronger so that you will be strong. Then when you come back to the body, what makes the body is cell. And what does the cell need? We all know that it's ATP, source of energy, and other micro and macronutrients. So if you look at all this Islamic medicine, basically they are supplements, they are foods. They are food, basically. If you look at all the content, basically they are food. And the most important thing about the body is what you eat must be halal in Islam. If you eat haram, it destroys your body. Whatever you eat, no matter how good you eat, if you eat haram, it destroys your body. So the first thing is the unit in your body is halal. It's halal. So, and the first thing that you need in your heart, you need to take care of what you hear, and you need to take care of what you saw or what you are seeing in your body, because it has direct links with your heart. And Allah subhanahu wa ta'ala don't look about whatever you do, is looking at your heart, the goodness of your heart. So that's why me, I'm practically, presently I'm practicing this part of medicine that's unofficially. You understand? It has to do with a lot of spiritual, inclination. Depression and so many other psychological illnesses, I do take care of it. With prayers, with azkar, with no counseling, you can take care of all these things. Using the verse of the Holy Quran and a hadith of Rasulullah without necessarily giving something a return. You understand? So I think we need to go back to Quran and answer very well. Thank you very much.
All right.
Thank you.
Thank you so much, sir.
I also stated a particular research concerning this, listening to the recitation of the Holy Quran is there in the presentation. Okay. Thank you.
Yes.
Thank you so much.
Yes.
Musa.
If he's not there, Nuruddin, are you there? Let us be brief. The time has gone. Nuruddin.
Okay.
Okay, Wada.
Professor Wada.
Yes, Wada.
Okay, Jude should be around. Okay, sorry. I have to.
Please, unmute him.
Okay, sorry. I did, so hello? Yeah, we can hear you.
Assalamualaikum. Hello, can I go ahead? I'm Ibrahim Yunusa.
Okay, Ibrahim Yunusa, go ahead.
Yeah, good morning, Dr. Abbas. Thank you very much for your wonderful presentation on Islamic medicine. I just want to actually add some few contributions. First and foremost, when you look at this aspect of Islamic medicine, just like you have mentioned from your presentation, issues of this traditional Arabic and Islamic medicine comes in because of the non-satisfactory issues with the conventional Orthodox medicine. So, and then when you check also, I believe I want to even make reference to one particular book, which is The Gene and the Human Sickness. And then not only that, there's also another book. So the father of medicine, I believe, is Hippocrates. So, and then in one of his, I think, books, or let me say, yes, in one of his books, the first opening chapter of that book, there's a statement he mentioned and quoted. And I believe I would like to share it with some of us. What he said is that every illness on earth is as a result of two things. I believe in some slides, Dr. Abbas have mentioned it. The one of them is the spiritual cause, and then the other is the non-spiritual, which ranges from hormonal balance, infectious disease, and the rest of them. And then as a physician, it's very important for you to identify each of these causes. One, spiritual, if it's spiritual, you have assessed and you find out that yes, there's spiritual inclination to this, then it's important for you to refer that patient back to where he's going to get a solution to that spiritual illness. Otherwise, once you continue the management as the conventional orthodox, you end up causing more problem. And then to even confirm this more, when you check the gene and human sickness, you find out that there are a lot of chronic diseases today that are caused as a result of genes and some other evil factors. For instance, when you take tumor, cancers, of course, when you take, for instance, the human papilloma virus, which manifests as growth and the rest of them, you find out that yes, this is a venereal disease. It can come as a result of sexual exposure, this, that, and so on and so forth. But there are situations whereby you find out that most of these risk factors are not there. The patient is actually not exposed to any of these, and then you still have a growth. And then sometimes the worst part is even when you go to clinical practice or community practice, you find out that you are given a particular management using the orthodox medicine for a particular illness, and then you are not observing any changes. In fact, the condition is getting from bad to worse and the rest of them. So in this kind of case, I believe when you when you understand the concept of these two causes, it will be able to guide even in the future management. And of course, as a result of this non-satisfactory factor, by patients that patronize the orthodox medicine, of course, I believe it's not surprising for you to see proliferation of Islamic chemists, just like someone have mentioned in some states in Nigeria. So thank you so much.
Thank you so much. Before the moderator, please could those who are asking questions, could they please summarize, because we have gone a bit far the time. And I would also like to use this opportunity on behalf of Pharmacy Scholars Initiative, the moderator and the guest speaker, to welcome pharmacist Bayero Ahmed, the Director, Research and Statistics, Pharmaceutical Council of Nigeria, Head Office. Alhaji, if you have time, you can say some few words for us on the webinar. Alhaji. Assalamu alaikum, Alhaji.
Salam.
Oh, alaikum salam, Alhaji. If you have time, you can say some few words to us.
Just to say, I'm enjoying the presentations as well as the interactions.
Okay, alhamdulillah.
They are all educative, and I want to thank you for this effort of exploring new frontiers in health.
Inshallah.
May Allah reward you abundantly.
Amen. So thank you so much.
Thank you. Thank you.
All right, Alhaji. The moderator, you can continue, please.
All right.
So, Jude, I think we can have two or more. Jude has been raising hand. So the three of them, Jude, Momo, and Wada. Yeah, can you please be brief?
Yes, Wada, please, are you here? He's not here too.
Yes.
Sada, Jude, are you here, please?
So, Momo, are you there?
Assalamu alaikum wa rahmatullah.
Wa alaikum salam.
I've been muted since, so I.
Okay, sorry.
First of all, I would like to thank Mr. Abbas Musa for the presentation. Well put. To what Faith earlier said, you see, the need for, I asked the question about collaboration, and I'm very happy that the representative of the PCN is also here. The problem that exists between this collaboration is actually not a difficult one. It's something we can actually address. I can remember there was a time when proposals were made to even give or to form like a diploma courses for those that practice traditional medicine. This will try to bring together what they know and what they don't know, so that they will understand that combining either prophetic Islamic medicine or other traditional medicine with some of the Orthodox medicine may not be a problem. So if you look at what the earlier presenter, the person that also talked, this Salman Umar, he also mentioned that most of the Islamic medicines are actually supplements. So if we can bring them on board and have a diploma course for them so that they can understand where we are heading to, where we are coming from and where we are heading to, how we see illnesses and diseases, and how they also see illnesses, we can bridge the gap and address some of these questions so that they will know, okay, this is where my own expertise should stop, and this is where I should refer to the proper healthcare. If we can do this, we can upgrade their sorry to say, their thinking and their probably understanding of the whole of Orthodox medicine. I believe it's high time the PCN also looked us into this to bring some of these professional courses for some of these practitioners. This is just to bridge the gap between the Orthodox and the normal practitioners. Doing this will actually help a lot, because some of their methods are actually very effective, and they see us as aliens. We see them as not actually scientists. So bridging the gap will help a lot. And by and large, it's a very nice presentation, and I would suggest this presentation should be compiled and actually presented to the larger community as either a publication or something like that. Thank you very much.
Tilde.
Yes, so me, my own directive mention about if you are on lemon and nutmeg in water, right? So I don't know. From the little I know nutmeg is haram, is a bit controversial, because I know that it has intoxicating properties, and we are told anything that has intoxicating properties, even in small quantities, is haram. And then one of the person that just talk about taking halal food. So I don't know the status of nutmeg. If maybe you have researched on it, if there's any other thing you can let us know, please.
Okay, yes. Oh, I think I'm the one who mentioned the issue of nutmeg. Yeah, before taking it, the only thing I saw regarding it is the issue of the toxicity. Like if you take it in higher doses daily, yeah, it can lead to some mental issues. Yeah. So me, I took it in small quantity and not every day. It's only cinnamon that I know I take it every day because I like the taste. But I haven't yet come across where it is being classified as haram. But if you have any literature, please let me have it. I'll appreciate reading it.
All right.
because it is very commonly used in India and most of the Asian countries.
In fact, if you take a lecture of Dr. Tim,
Yeah.
there's a whole session on nutmeg, and that
Oh,
was when I really truly what something a little bit controversial, and a lot of people are not.
Oh, okay. Please, if you have the literature, please let me have it because it's good. I should know. Thank you.
Okay, Nuhu Mama, if you're around.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullah.
First of all, I want to thank Dr. Abbas for this wonderful presentation. I think what I really wanted to talk about is bridging the gap between Islamic medicine and Western medicine, and Dr. Wada has spoken a lot about that. And I think we need to give these people a sense of belonging, especially in Nigeria. We see this part of medicine as a lot of us see it has not been scientific to some extent. And I think you need to begin to take a holistic approach and look at it, at how we can match Islamic medicine vis-a-vis Orthodox medicine. For example, the issue of the herbal soda for treatment of diabetics. I think I've seen the literature once, and I try to experiment it. My mom happens to be diabetic, and I try to just intermarry it with our regular anti-diabetic drugs. And I noticed that gradually, she was having a better glycemic control, because at some point I have to tailor down her anti-diabetic just from about 4 drugs to about 2 drugs. So, and it was really actually very helpful. And I think if we decide to actually go into extensive research and begin to do 1 or 2 things, we'll now be able to provide evidence that we can intermarry actually the Orthodox and the Islamic medicine vis-a-vis each other, and to give our patient the best treatment outcome. So overall, it's a very nice and wonderful presentation and an eye-opener for all of us. Thank you.
Okay, thank you very much. Any more questions, comments, or observations?
Dr. Shaban, do you have anything to say before we proceed, before we close the session?
Okay, sorry, Nuruddin Usman is back. I don't know, host, can you unmute him, please?
Okay. Done.
Thank you.
Thank you very much for unmuting me last week. I don't know, Ibrahim Tatel has an issue with you. That's why he's used to.
Sorry, sir.
I think you have already exhausted the presentation and people are already overstretched. I had wanted to say a number of things that the presenter has raised. This is actually a very good presentation, and the presenter has raised a lot of questions, and he has also answered a lot of questions. One very good thing I would like to raise, the point he has raised, the issue of understanding diagnosis. I think he tried to answer a question sent by someone who was looking for a remedy for sleep for his either father or something. And I like the way he responded to the question. And I think that's the point the presenter has tried to portray in most of what he has said. We know a lot of diseases have similarities in terms of symptoms and presentation. When you go to either herbal medicines or Islamic chemistry, what they do to just assume. When we talk about prophetic medicine or Islamic medicine, in most cases, the prophet was very specific about diseases and about particular herb, be it herbatus sauda or the rest of it. But what we end up seeing these days, you hardly differentiate between the Islamic medicine itself and the ordinary herbalist. What you see is a mixture of concoction, which if you stick to know the content, nobody will tell you. And anybody that comes in to see, this is what I have, this is what I have in terms of symptoms, they'll just conclude that this is the disease. And this is where the problem is. People tend to give diagnosis to anything they come across, and therefore give any type of medication for management or treatment. And I think those of us who want to have collaboration, who want to integrate the orthodox, and we have to understand this. And the presenter raised a very valid point that we don't even subject those things to research and validation in the scientific world. For you to come out and make a general statement, of course, as a true Muslim, there is no way you hear that the Prophet said this about this or said that about this and you dispute it. But I think based on the context of a lot of ulama, the presenter has brought a lot of classes of thought about different understanding of what the Prophet said. So to that effect, we must be very, very careful so that we avoid predisposing people to a lot of people have got their cancers, got to the advanced stage as a result of stopping them from taking orthodox drugs. A lot of people have got stroke and other complications of diabetes and hypertension as a result of either combining or stopping them from orthodox medicine. Those people, we are just unlucky to find ourselves in a region, especially Africa and Nigeria, where once you mention religion, people will just submit. And people have used this platform to extort a lot of people. Are we really having specialist Islamic people who operate as Islamic chemists, or we have people who exploit others? So these are issues we must be very, very careful. And these guys have been given platforms under our local and some general media to advertise. When you listen to the advertisement, you know a lot of things are wrong. People mix the Prophet saying and many other things and continue to discuss. So what I'm saying in essence is that Islamic medicine is true and everything about it is true. And there are limitations we must understand and there are advantages we must understand. Today's bone setters, where you go to bone setters, X-ray. When they bone, so they for X-ray, they are broken. But others don't do that. These are issues. There are issues. And we must find the presenter and make recognizer.
Okay, thank you very much. Dr. Momo, are you around? Dr. Momo, are you around for the presentation of certificate?
Hello, if he's not around, let me just do it.
Okay.
So we would like to thank everyone for having time to participate in our first webinar for the year 2022. Who is? Sorry, I'm coming. All right. So I would like to, on behalf of Pharmacy Scholars Initiative, to present a certificate of appreciation to Pharm Abbas Musa, which we in PSI, any member is a doctor. So, but I'll present him as Pharm Abbas Musa for his outstanding contribution as the guest speaker at the PSI webinar on 16 January 2022. We would like to appreciate your efforts on behalf of everyone and including the participants who are not a member. And then I would also like to present another certificate to our moderator, Safiya Borodo, a faculty member, Faculty of Pharmaceutical Sciences, Bayero University, Kano, for her outstanding contribution as a moderator for the PSI weekly webinar on today, 16/01/2022. Aja, we really appreciate you for moderating this session. And on behalf of PSI, I would also like to thank everyone for finding time to attend to our webinar. We really appreciate and looking forward to see you in our subsequent ones. And the copy of the other recordings will be shared on our website. I've already posted the web link to the website. So inshallah, we'll make it available as soon as possible. Thank you so much. Thank you so much. Okay, Brian Musa, please, just because we have already spent 2 hours, can you be brief? I think Haja just round up.
Okay, thank you very much everyone for attending this very interesting and captivating presentation. And I hope, as it has been suggested, there will be room for collaboration for the benefit of all. And please, when he talked about that issue of depression, I remember there was a journal I read, which research was made. The use of listening to Surah Al-Rahman was used to treat depression in one of the Asian countries, particularly in women. So thank you very much, Dr. Abbas, and thank you all for attending.
All right. Bye-bye. Have a good day. Nice, man. We can talk unofficial.